improving the health of London is hugely important for the Mayor, and it's part of a key part of our work programme at the GLA, and it's something that runs through everything that we do at the GLA. And the reason for prioritising this is simple. The healthy life expectancy is too short for many Londoners, and it's much shorter for some than for others. And these inequalities are unfair, and it's unacceptable that in a city as prosperous as London, so many people live extended periods of their life in poor health when this could be avoided. We think London has the potential to become the world's healthiest global city, and the Mayor, Sadiq Khan, and I want all Londoners to have the best opportunities to live a good, long life in good health. But if we're to achieve this, we have to play a part, all of us, in tackling the causes of poor health, and we all need to commit to make London a healthier and fairer city where nobody's health suffers because of who they are or where they live. When we fail to keep people healthy, demand for health and care services grows, and the care Londoners need can become complex and enduring. And what's more, the health of Londoners underpins our economic growth and prosperity. London will never realise its full potential while so many Londoners struggle with poor health. We know that addressing the wider determinants of health, the conditions in which people are born, grow, live, work and age, is the most important thing that can be done to improve the situation for Londoners and to achieve that long-term change. This is about Londoners' physical and mental health. It's about supporting people from the very earliest stage of their lives, and by giving children a healthy start, we're giving them the best chance to remain healthy throughout their lives. And it's for that reason that the Mayor has adopted a health in all policies approach, helping to address the determinants of health through a range of his strategies and policies. And this includes, and you'll have seen a number of strategies coming out from the GLA, from transportation through to the London Plan, which sets the development plan for London, housing and so on. But obviously key to my heart is the environment strategy. And within that, a key area is air pollution, where we're taking this approach. So you'll know that Sadiq has made this one of his major priorities for his administration. And the reason is it's the statistics. It's shocking that in this day and age, 2 million Londoners, including more than 400,000 children, are living in areas which exceed legal limits for nitrogen dioxide, one of the key pollutants. And as many of you I know, I'm sure, will only be too aware, thousands of Londoners are dying early every year as a result of that toxic air. It's stunting the growth of children's lungs in ways that will affect them throughout their lives. It's a cause of cancer and increases the risk of asthma, stroke, type 2 diabetes and dementia. And on average, 4 Londoners, including 1 child, are hospitalised every day due to asthma caused by air pollution. Children are among the most vulnerable to the health impacts of polluted air. Yet over 450 schools and around 20% of primary schools in London are in areas of air pollution which exceed our legal air quality limits. And a child born in 2010 would lose 2 years of life expectancy because of air pollution if the quality of air doesn't improve. We also know London, people in London's most deprived areas are more likely to suffer poor air quality, yet they're least likely to own a car and contribute to the pollution problem in their local area. So this isn't just a public health issue, and Sadiq has made it very clear, this is also a social justice issue. We want to look at how do we reduce and tackle those inequalities. And that's why we've made tackling our dangerously polluted air a priority. And I just wanted to give you a little bit of a flavour of some of the things we're doing to address that problem. So we're currently in a building which is situated within the ultra-low emission zone, or ULEZ for short. It's the world's first ultra-low emission zone. And since the 8th of April this year, vehicles that don't meet strict new emission standards need to pay a charge to drive into central London. And this operates all year round, 24 hours, 24/7, so 7 days a week, all year round. And from 2020, the zone will be expanded to the whole of London for heavy vehicles like lorries and coaches. And then from 2021, it will be extended up to the north and south circulars for cars and vans. So that's going to cover a population of about 3.8 million people. And the ULEZ has the strictest emission standards of any global city, and we believe it's the largest zone of its type in Europe. And we expect ULEZ to have a significant impact in improving air quality in London. We expect it to reduce vehicle exhaust NOx emissions in central London by around 45% in 2020. And these positive effects will be especially beneficial to the young, older people, and those who have respiratory problems, as well as Londoners who live in high pollution areas. And the scheme is already working. Since the 8th of April, 74% of vehicles in the central zone have met those standards over an average 24-hour period. And this is a really significant increase from 39% in February 2017, which is when the Mayor first confirmed plans for the predecessor scheme, the toxicity charge. And that was a very important stepping stone to the ULEZ, to basically raise awareness this was coming, to allow people to prepare, but also so that we could work with NGOs, health professionals like you in the room, schools, others, the community, to really raise awareness of the effects of air pollution and sort of giving people the alternatives and sort of helping them to change behaviours. And this has meant we're seeing a reduction in the number of older and more polluting vehicles in the ultra-low emission zone area, with over 9,400 fewer of these vehicles detected on average per day in April compared to March. But what's really exciting is this is translating into real-world improvements in air quality, including a reduction of approximately 20% in NO2 roadside concentrations in central London. So this shows that we're putting the right bold measures in place to protect lives. But this isn't the Mayor. It's sort of the Mayor is seen to be able to do lots of things, but actually the Mayor's powers are quite limited, and we'll probably touch on some of these things in the questions. But we don't have powers over health. We have some powers over land use planning, but local planning is done by the boroughs. We have some powers over transportation, but only on 5% of the roads, the strategic roads in London. So 95% of those roads are managed by the boroughs. So the Mayor's work is really about working on every lever that he can use, using his convening power, his voice, his influence to really to make changes. So I can talk a little bit about those things in a minute, but one of the key areas is to lead by example. So, which is why he's asked Transport for London, our transport agency, to make sure that the bus fleet operating in London is cleaner, much cleaner. So we've asked TfL to retrofit thousands of vehicles to the Euro 6 standard and phase out diesel buses. 75% of Transport for London's bus fleet are now meeting that ULEZ standard, including all buses in central London. We've committed to only procuring buses with zero-emission engines from 2020, so aiming for the entire fleet of 9,000 buses to become zero-emission by 2037 or earlier. We've introduced a concept called low-emission bus zones, where we've identified some of the routes in London which are really heavily polluted and sort of started with those, transforming those buses into cleaner buses. And these low-emission bus zones, there are 12 of them planned. We've implemented 10 already. And they're seeing a really significant reduction in pollutant levels along those routes, so helping to reduce exposure of people in those areas. And one of them, Putney Low Emission Bus Zone, has reduced hourly NO2 exceedances by 99% since 2016. So you can see some quite simple measures can have some quite dramatic effects, but really we still need to do much more systemic changes, which obviously are much harder. We've also applied new standards to taxis and private hire vehicles to drive down emissions from that sector. We've stopped licensing new diesel taxis, and we're currently supporting the black cab trade to upgrade to much cleaner, zero-emission capable vehicles. You may have seen some of those on the street. So since the beginning of 2018, we now have over 1,500 of those. They're fabulous. The drivers love them, people love them, and obviously they're really good in terms of not producing pollution. And the problem, though, is that there are over 100,000 of those vehicles. So that's a big challenge to retrofit and to change those people's behaviours. It's an economic issue for those drivers as well. The Mayor has provided funding to help them with a delicensing scheme, a scrappage scheme. But it's a drop in the ocean. This is something that we've been arguing with government for a long time about how can we get government to help with scrappage schemes, not only for those taxi drivers, but for low-income Londoners and also for vans, charities and so on. So again, the Mayor has made available some money to do that, but it's nowhere near enough to what is needed. And it's an issue that we've joined forces with Metro Mayors around London, across the country, because this isn't a London issue. This isn't even a UK issue. It's a global issue, as we'll hear, no doubt, in a minute. But whilst reducing pollution at the source is key, we're aware that policies to deliver this can be slow to implement, especially when new national policy is required. So we're really focusing on what we can do with the powers and levers we have to reduce the exposure of those living in London now, especially the most vulnerable. So one of the most vulnerable sectors are obviously children. So we looked at schools. We've identified, I've already mentioned, about the 450 schools in polluted areas. So we decided to fund at the worst 50 schools a series of air quality audits targeted at primary schools, and we're extending this to 20 nursery schools this year. And each school was given a tailored audit and then identified recommendations for those schools on how they might be able to reduce children's exposure. These are things that they can do themselves, or that they have to work with the local authority to do, or others. It's not... We've been able to provide some funding to help kickstart the programme. They'll be working with the local authorities who've been given funding through the Transport for London funding programme. These are long-term projects, but it really helps identify some of the more simple measures that schools can take, parents and governors, to help reduce exposure as far as possible. And you've seen some of the things, I think, in school streets, which are, fabulous ideas where you can close the street in front of the school, and it really helps children to start thinking about, not just children, but their parents thinking about walking, bicycling, scooting to school, which then helps our other agenda, obviously, in terms of reducing or improving people's health by getting them to take more exercise and on a daily basis. In terms of what the health community can do, I hope you'll agree that we're doing as much as we can to clean up our polluted air within the powers that we have to improve the health of Londoners. But we're under no illusion that we can do this on our own. We need the support of people across London, and your help is going to be absolutely critical in delivering these essential policies. I would urge, for example, the hospitals in the room to sign up and work towards the Hospitals Clean Air Framework, launched by Great Ormond Street and the NGO Global Action Plan earlier this year. You can also support the NHS long-term plan commitments on air pollution by supporting your workforce to use active travel like cycling and walking to improve health and well-being. But crucially, you also have a very strong and influential voice locally and nationally. The government is currently drafting new clean air legislation under a new Environment Act. We need a Clean Air Act that's fit for the 21st century. And this is a once-in-a-generation opportunity to enshrine the right to clean air in law. As professionals working either directly in the health sector or influencing the urban environment, you have a powerful voice in this debate, and I would really encourage you to make this heard. So here in London, we are hugely optimistic that we can make a real difference to the health of Londoners. I think you'll see that we really are trying, and in some areas we are. But without our policies to clean up our dangerously polluted air, we had King's College do an assessment, and it would take 193 years in London to reach legal air quality limits. That's millions of children through numerous generations breathing air that can stunt the growth of their lungs. But through the work we're doing here in London, with our partners and with many of you in this room, we expect to bring our air quality into legal compliance in just 6 years, improving the lives of millions of Londoners. And that's through policies that I've mentioned, like the ultra-low emission zone, through shorter terms interventions like the low emission bus zones, like working with schools and so on, through our working on development and getting developers to understand how they build and develop their new developments can help to at least not make air quality worse, but actually help to contribute to make air quality better. So lots of areas that we can be working on, which is why that 6 years is absolutely achievable and critical. So I hope we can continue to work together, not just on air quality, but on improving the health of all Londoners. So thank you really, again, for your help in that challenge. Sadiq is really appreciative. And thank you once again for the opportunity to speak. Thank you.